I use and continue to locate quite a few different strategies to help me process my grief. As a trained counselor, I'm very comfortable and knowledgeable about locating resources. And so, right away after the loss of my husband, I was able to seek out some excellent counseling resources, group therapy resources, and also some general holistic healing types of resources. And so, I've early on was able to really create a team of people to support me, a team of healers, I guess, to help me with my own process. It's very important, and I learned this early on, to really slow things down. And one of the main strategies that has helped me is my own self-care. And some days, especially early on, it was as simple as just making sure I would eat during the day and sleep when I was tired and just listen to my body. As time has gone on, I find myself often ramping up and getting busier as life goes on, and that happens. But I still have to utilize the self-care strategies and rein it back in, and tell myself that it's okay if I'm tired. It's okay if I have to go to bed early. It's okay to say no to social invitations. And so it's really important to focus on the strategies that work best. And for me, it's been self-care and slowing down, and really finding some quiet time to reflect and be with my own spirituality and feel connected to my husband after his loss. It's often, it's often a challenge because, like I said, life is getting back to normal, whatever that is, and we're still in the pandemic, but we're not quite as isolated as we were. And so my natural instinct is to get busy and to use diversions to not think about grieving or not think about my healing. And so I have to often slow down and get back to the basics of self-care, and also participate in my regular therapy sessions, group therapy, and additional, self types of training and education and reading and learning about grief and about healing. The pandemic has impacted my own self-care and strategies, in that resources are limited. Things are different now. Early on, I wasn't able to participate in face-to-face therapy, and so utilizing Zoom was able to at least keep my therapy going and feel like I had some level of support. But I'm trying very hard as this process moves on to find strategies that work for me in the moment, and to do best to take care of myself, and also to support my kids in their own care.